Senator John Thune out of South Dakota, Senate Republican Conference Chair with me now. And sir, good morning to you and welcome back.
Good morning,
to our
Bill.
program.
Nice to be with you.
Many would argue there are pros and cons 5 years in. Supporters of the law say more people have insurance and those with pre-existing conditions now have insurance as well. What is wrong with that?
Well, it doesn't fit the reality for most Americans. The president is going to emphasize what he thinks are the pros, Bill, but the experience that most Americans have had is higher premiums, higher deductibles, loss of the plan that they wanted to keep, fewer doctors, and fewer jobs. It's had an impact on the economy. This health care plan that the president put forward 5 years later, that's the result. That's the story today. And for most Americans, that's their experience, which is why this is not going to be a happy anniversary for them.
Well, are you suggesting the administration's lying about the numbers we have so far?
I think the administration is trying to make the numbers fit the narrative that they want to get out there. And sure, there are some people who have gotten help and are now getting subsidies, but it's a small number compared to the number of Americans who have had bad experiences with Obamacare. As I said, for most people, what this has meant is many of them lost the coverage that they liked. Those that didn't are having to pay higher premiums, higher deductibles, higher copays, and it's had a profound impact on the economy in an adverse way. So if you look at the overall picture and get away from the narrow view that the president's trying to take of this, it's not been a good thing for the American people, and that's why we as Republicans in Congress are anxious to have an opportunity to repeal and replace it with something that's better, that provides more affordable and accessible care.
Sorry, Senator, how do you make it better?
Well, I think what you've got to do is get away from a government-run, heavy-handed, mandated benefits out of Washington, D.C. and move toward more freedom, more choice, greater competition, and there are lots of ways in which you can do that. And the way that the president chose to go with Obamacare was more government involvement and government calling the shots. We believe the American people, consumers, patients, doctors, they're the ones who ought to be calling the shots when it comes to people's health care, and the government shouldn't get in the way in the relationship between patients and doctors.